Absolutely delighted now to be joined by NIH's Aubrey Miller. Aubrey, welcome.
Thank you.
Lovely to have you here.
Absolutely appreciate it. Excited to be here.
So the session's coming up. Tell us a little bit about the session.
I'm very excited about the session. So the session's going to focus on how we can bring the environmental health or public health community together with the geohealth and geosciences community. So it's really focused on how do we bring our different scientific disciplines and where we sit in order to address really important public health problems, such as disasters. And that's the focus of the session, really. So we're going to talk about it from differing perspectives, and folks are going to kind of talk about it in sort of from geosciences, health sciences, and why it's important for us to come together and blend our sciences quickly, smartly, and effectively to address really important public health situations.
So everybody around here was going to say, that makes sense, let's work together. But what are some of the challenges involved?
Yeah, thanks for asking. And there has been big challenges in this area, and people really don't realize that in general, when we do research after disasters, it's very much ad hoc. There is no real platform, not in the US or globally, to be able to bring the research community together to address these problems and to do fundamental research, especially over the longer term, to do this and to address these disaster situations. So when people think, oh, there's a hurricane that just came through, they must be out there getting all this data. No, it's actually very hard and very haphazard. And when we connect the dots, say, between environmental data or exposure data, a lot of times we might get some human health data, but we don't connect those. We don't do them together. It's not collected together, not connected efficiently or smartly in a way that benefits the community or benefits even the scientific community over the long term. So there's a lot of challenges. Some are process, some are funding, some have to do with the way the government emergency response system has been orchestrated. So that's what we want to work on, and that's why we're here.
Give us an idea of what best practice looks like. Give us an idea of what you're doing to affect progress.
Yeah. So, and that's the exciting opportunity here, right? So can we think together, creating a community of practice of researchers from different disciplines, whether you're in hydrology or atmospheric sciences or looking at natural hazards, or from the human health side are doing either studies of epidemiology studies and trying to understand the health effects in populations or mental health. Can we think ahead together, plan things ahead together, create essentially a network across the nation and across the globe that can work together and then work on how do we build more structure around us? How do we get the funding agencies to support it? But how do we create what we envision to be the right thing to do? The right thing to do is to bring our best science. Right. The taxpayers and others are paying for it. Right. They expect us to deliver it, and we should be able to think about what we can do and what we can bring to our communities quickly and effectively so that we can help them, and also we can be prepared for the future and be able to help make changes that help us prepare for the future.
So my final question, let's talk about the future. So there's 20-odd thousand people here this week. What can they do?
Yeah, so partly is if folks have a chance to watch or participate in the session, but certainly to participate with the activities of geohealth and natural hazards in some of the sections, but start to think about it themselves. Because everybody's kind of involved in their science and they're busy with their science, but I think they need to think about where does that science go? How do they translate that science to the community or get it to people that can help do that? So whether it's connecting with people at your university or connecting at NIH or other agencies, but trying to ask those questions is, how do I help deliver my science, whether you're studying the effects of water or climate change, right, to the community in a way that it can be used, and start thinking about the issue of if something happens in your area, how do you contribute to that? And I find scientists all the time, well, if something was to happen here in Houston or here in Washington or wherever you live, what's your role?
Right.
Who do you connect with? Who can you partner with to be out there and working with the community or identifying some of the issues? Today I had a great moment with just talking to some young folks that were doing studies on water around Cape Fear in North Carolina and the contamination that happened after Hurricane Florence. They hadn't thought about, well, can I connect that with the people that are studying the health effects,
Right.
just didn't occur to them. So there's all sorts of things like that going on that we can take advantage of. And AGU, the community of AGU, is an invaluable resource across the world to be able to think about this and help us figure out a way to move it forward.
Well, Aubrey, thank you ever so much indeed for joining us today. We really appreciate it.
Thank you.
AGU TV has all the coverage you could want from this year's conference. Now make sure to explore all of our content, which is updated each and every day of the conference, to stay up to date with all the very latest AGU news.